Good afternoon and thanks for joining us. I'm Judy Simpson. Today we continue our occasional series of programs in partnership with the Vermont Cancer Center. The center provides the expert guests to help answer questions about specific cancers, including diagnosis, treatment, and research. It is largely because of research that many cancers are no longer the death sentence that they once were. There are now more than 10 million cancer survivors in this country, including some 35,000 here in Vermont. This Sunday, June 2nd, marks the annual National Cancer Survivors Day, and to learn more about what that is, I'm joined by two members of the Vermont Cancer Center. Dr. Patty O'Brien and Dr. Kim Dittus are also professors in the UVM College of Medicine. Welcome to both of you.
Thank you.
Now, Patty, survivorship is a word that means sort of different things to different people. What does it mean to the cancer community?
Well, it's interesting. Some people don't even like to be called a cancer survivor because they think, oh, well, I just had a little cancer. I don't get to have that term. But in actuality, cancer survivor is from the moment of diagnosis the rest of your life. And so it's a very non-specific term that just refers to you throughout that cancer journey. And the idea is just so that as people are trying to collect information about survivors and their health needs and long-term things, they needed a term as to what to call all this people, because it's a growing population of people that needed a term to define them. So it's really very non-specific, but it basically refers to anyone who's been treated for cancer at any point in their journey.
And so, Kim, why is there more attention on survivorship now?
I think, as you pointed out in the introduction, there are a large number of cancer survivors, but that hasn't always been the case. In 1973, there were 3 million cancer survivors, and as a result of a lot of research in terms of treatment and screening, there are now approaching actually 13 million cancer survivors, and it's expected to be 18 million by 2022. And that has given us an opportunity to really focus on the aftermath of cancer treatment and look at cancer survivor issues and the impact on quality of life and deconditioning and how individuals live beyond cancer.
What are some of the follow-up needs that people will have?
So individuals, after they experience cancer and cancer treatment, often have, they're often fatigued, deconditioned, and have quality of life impairment. And it is a psychological burden as well in terms of worrying about cancer recurrence.
And so, Patty, how do cancer survivors generally learn about all of this?
So there's a long list of things that a cancer survivor might be concerned about, but they can typically get a nice summary of all of those issues in a survivor document. So the survivor document will be a summary of the many different issues. So it may talk about their emotional health and outline, what some of their issues had been and how they can get treated for further ones, physical endurance, some parameters about their fatigue. Cardiopulmonary is very important. So people may not realize, oh yes, I had part of my body radiated, that may affect my lung function. Oh, I had drugs that affected my heart, that might affect my, quote, cardiopulmonary status. They may have cognitive issues. Often patients refer to it as chemo brain, meaning that there may be some short-term memory issues, surgical scars. We think of scars as something that just heal, but scar tissue can go deep inside and you can have some long-term consequences from that. Radiation therapy leaves you with a different set of scars than what you got from your surgical scars. And the treatments, you may have gotten steroids, which caused you to gain some weight. You may have gone into menopause from the treatments, and we all know menopause has its own issues. If you had surgery to your bowel, you may have bowel changes, or the drugs may have changed your bowels. Something that we're finally talking much more openly about is sexuality. How did people's sexuality change? And people want to be sexually active after cancer, but they may not be able to be active the way they used to be, and they may need guidance with that. And more people are going on to have children after being treated for cancer, so they may need an infertility specialist to help them with that. And many people have anemia, so there's this long laundry list of issues that they need to understand that these are just side effects of their treatment. They shouldn't be afraid of them. They should get help for them. And that's what the Survivor document is about, to sit down with people. You get it after you're done the acute phase of your treatment, and it's just a chance to sit down and sort of collect your thoughts and say, oh, I have this feeling about my body. Oh, it's not quite the same body it used to be, but I don't need to be afraid of it. This is what my treatment was. These are the side effects of that treatment, and it helps that patient understand themselves, but it also helps the oncologist pass that patient on to the primary care doc. Because we don't want people to live in oncology forever. If you're treated at age 20, you need to go back to your primary care doc and go have a long, healthy life and just see your primary care physician, unless there's some reason for you to come back to oncology. So it's a way to kind of graduate people from the cancer community and
I think that,
move them on.
If people haven't gone through this, they think that, okay, well, I've been diagnosed, I have my treatment, I'm done.
Yeah. And that's kind of a simplistic thing. It's really, it can be a hard transition for some people, emotionally, physically.
Well, your life has changed.
Yeah. And the more you admit that your life has changed, then you can accept all the help about how to kind of put your life back together.
Now, I know, Patty, you've talked openly about the fact that you're a cancer survivor. What helped empower you?
Oh boy, so many people along the way. I mean, just so many people along the way, other survivors. I needed a lot of counseling. I kind of went into crisis because my pre-cancer life was not going to be the same as, my post-cancer life was going to be very different, and I needed some help sort of adjusting to that. I mean, that was many years ago, and I'm now like happy, but I wasn't always happy.
Is that something that is, now commonly part of people's treatment, is to say, look, you are going to be going through these changes?
I think we try to do it, but it's a very busy clinic, and people need to be open to listening to that. I mean, sometimes there's a strong denial of, I am the same and I can do this. And, you need to sit people down and say, your body's a little different and we just need you to understand that. And some people have gotten hit much harder than others, and some people financially are just totally overwhelmed by what just happened to them. So everybody came into cancer different. Everybody had a different cancer experience, and they're going to go on and live their post-treatment life differently. And we're just trying to build an infrastructure that supports them wherever they're at in this journey.
Now, Kim, you have a specific program called Steps to Wellness. What does that entail?
Steps to Wellness is our oncology rehabilitation program, and this is a program that Patty and I initiated in August of 2011. And for cancer survivors and cancer patients, their experience is a little bit different than, for example, if you have a heart attack or have cardiac issues, because with that particular situation, insurance pays for a cardiac rehabilitation program. There's not a similar rehabilitation program for cancer survivors, and that was our goal, is to develop oncology rehabilitation. And so the goal of this program is to have individuals either during therapy or after therapy come to a medically supervised situation where they can continue to be active. And our hope is that individuals will be less fatigued, that they will be less deconditioned, that their fitness will not decrease as much as it might if they didn't go through the oncology rehabilitation program. And one of the wonderful side effects of that program is that people feel like they've been caught then after their treatment and have an opportunity to transition to begin to find out what their life might be like afterwards. And we're actually seeing, when we do our evaluations before and after, that people's depression is less, their anxiety is less, and in addition, they're more fit and are stronger.
It's also too important, I would think, that people don't just rush right back in to try to be as active as they were before their treatment.
Yeah, there are definitely some people who can do that, and I think it's important to be as active as you can during treatment as well. So it depends a lot on how fit you were to begin with.
Mm-hmm. And so what do you hear from people who have gone through the program or are going through the program?
I think the most important thing we hear is the social and psychological benefits. My goal was to get them more fit and less deconditioned and more active, and I think that the wonderful side effect is this camaraderie that they have out at the gym with the athletic trainers that we have and with each other. I think that has been the most surprising aspect of the whole program.
Mm-hmm. And what do you get out of doing this and helping these folks? The research, I suppose.
Yeah, so I think it's incredibly important that we collect information on individuals who have had cancer therapy and what we can do from an exercise intervention perspective or physical therapy perspective to get them to a healthier state. And I would love to see insurance cover oncology rehabilitation in the future. Right now, our program is held at the cardiac rehab site. Phil Ades, the cardiologist in charge of cardiac rehab, has opened his doors to us, but we have had to raise money through individuals running the marathon and raising money and other kind donations in order to support the athletic trainers at the site.
Mm-hmm. And so, is this going to be a long-term project, do you think, as far as to get insurance on board with this?
Oh yeah, I think it definitely will be a long-term project. It will probably take several years. But in the meantime, I think that we have garnered a lot of support in the community to help support the program along the way.
Right. Patty, maybe if you could just address how important family is in this whole process, because a lot of people might be watching and have a family member who's been going through something like this.
Yeah.
How important is it to support them, and what's the best thing to do?
Yeah, and I think it really depends on, sort of the dynamics of that family. When I was diagnosed, I had, 2 little kids, one in elementary school, one in preschool, and, we needed to be sort of age appropriate in what we were telling our kids, and lots of people helped us try to keep our children's lives normal. My husband picked up a huge load of, frankly, taking care of me while I was going through the treatment. But I was extremely lucky. I had, sisters who just came in and said, you go take a nap, we'll make sure the kids get dinner. You go to the hospital, stay in the hospital while you need to, get that treatment. We'll just let your children's lives go on. And so different people are going to need different types of help, and I think it's important for our communities to kind of reach out and wrap people up with either, food brought in or babysitting or bringing kids to soccer games so that people's lives can be as normal as they can be.
Kim, if people want to know how to find out about the Steps to Wellness, what should they do?
The Steps to Wellness program is available to any cancer survivor, and there's a couple different ways that they can find out about the program. They can ask their oncologist, and the oncologists throughout the area are familiar with Steps to Wellness and oncology rehab and refer individuals to the program, or they can call the number that is provided with this program, and we can get them set up to be evaluated at Steps to Wellness. The Steps to Wellness program includes includes an evaluation with a physical therapist. A physician sees them also to summarize what needs they might have, and then they are able to exercise for free for 12 weeks, either on a Monday, Wednesday, or a Tuesday, Thursday in the gym with the athletic trainers. And so they get information about how to start exercising, how to exercise safely if they have range of motion issues, and
just adapt their workout to whatever their physical condition might be.
Right, and progress it to in order to get them perhaps even more fit than they were before they had their cancer diagnosis.
All right, well, I want to thank you both for joining me today.
Well, thank you for having us.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.
For a video copy of today's program, call toll-free 1-888-ATF-3430. Across the Fence is brought to you as a public service by University of Vermont Extension and WCAX-TV.